Good morning. I'm Dr. Michael Douglas from New South Wales Health with the COVID-19 update for Wednesday the 29th of December 2021. Across New South Wales, 95% of people aged 16 years and over have received the first dose of COVID vaccine, and 93.5% have received 2 doses. Of people aged 12 to 15 years, 81.6% have received a first dose of COVID-19 vaccine, and 78.2% have received 2 doses. Currently, there are 625 COVID-19 cases admitted to hospital, with 61 people in intensive care. 23 of these require ventilation support. In the 24 hours to 8 p.m. last night, there were 11,201 cases of COVID-19 reported in New South Wales. More than 157,000 COVID-19 tests were reported in that same period. Sadly, New South Wales Health today is reporting the death of 3 people with COVID-19. One woman in her 70s and one woman in her 90s. Both died at the Warrabrook Aged Care Facility in Newcastle, where they inquired their infections. The woman in her 90s had received 3 doses of COVID-19 vaccine and had an underlying health condition. The woman in her 70s had received 2 doses of the COVID-19 vaccine and also had underlying health conditions. A man in his 80s from the Sydney's inner west died at the Royal Prince Alfred Hospital. He had received 2 doses of the COVID-19 vaccine and also had underlying health conditions. New South Wales Health expresses its sincere condolences to their loved ones. A reminder to everyone across New South Wales to get vaccinated now if you've not had your first dose, and get your second dose as soon as it is due. We continue to see mostly unvaccinated people admitted to ICU. Thank you to everyone who has come forward to receive your booster vaccine. New South Wales booster program continues to ramp up, with the New South Wales Health already delivering more than 195,000 vaccine booster doses to help keep people safe and increase their levels of immunity against COVID-19. People aged 18 years and over are eligible for a booster after receiving their second dose. If you haven't yet booked for your booster, please visit the New South Wales Government website and book in today. New South Wales Health advises people to get tested for COVID-19 if they have symptoms, even if only mild, and to self-isolate until they receive a negative result. This public health advice applies to everyone, even people who are fully or partially vaccinated, as well as those who are unvaccinated. Testing capacity in New South Wales is under enormous pressure, and only people getting a PCR test should be those who have a COVID-19 symptoms, live in a household with a confirmed positive case, or have been in a venue where New South Wales Health has advised there has been a high transmission there. About a quarter of people exposed to COVID-19 may still develop their infection after 7 days. For the next 7 days, people should exercise caution and not enter a high-risk setting, should avoid large indoor gatherings, use a rapid antigen test if coming into contact with vulnerable people. Get tested and stay at home if you have even the mildest of symptoms. Do not visit family, friends or go to social events if you're unwell. Wash and sanitize your hands regularly. If you do not have symptoms, consider using a rapid antigen test before going out as an additional precaution, particularly if you're going out, planning to go out and socialise in groups or anywhere that may be difficult in keeping socially distanced. Again, thank you for your continuing efforts to get vaccinated, get tested, and helping to limit the spread of COVID-19. Please stay safe.